Ready?
7:31, we're
7:31, ready to
And then I
roll.
cut it.
we're live, Chad.
Two small pieces per package, and then I just,
Video's on.
I love it.
The recording session has begun. All right. Do you have introductions?
No guests today, just our team of superheroes here, usual, to our staff. So we don't have any introductions.
No capes today.
No, well, they capeless, so.
Okay. All right. We need approval of today's agenda items.
I have one change to the agenda item. When we send it early in the week, there's always last minute stuff that will pop up that the board needs to take action on. On item 3.2, we added to the appropriation increase one more sub item, 3.1.6. I highlighted on the agenda. I printed for you. So we would like for the board to approve that as part of the agenda for today's actions.
And what is that?
That is the COVID-19 vaccination project. We want to increase the appropriation in the equipment and software line item in the amount of $4,000, 140 and no cents. Yep.
Okay. Do we have a motion to approve?
So moved.
Second.
We're moving into consent agenda type today, and we're gonna try it, see if that will work a little better, expediting the meeting. So any of the items on the 2.0, we'll vote on just one vote on all of them. So if we have any questions, if people didn't have a chance to review the minutes, maybe you want to give them a minute to review the minutes, or any other items. We had all the leadership give their reports in writing as well. I don't know if some of you didn't have a chance to read those reports. We can do highlights like we usually do, but I think it will be more. I felt it's more better use of our time. We go over it ahead of time, then come with questions, and this way they will kind of discussions. So meeting minutes, any questions about the meeting minutes, any issues with the meeting minutes that we sent out?
So we need a motion to approve all the twos.
So moved.
Second.
All those in favor?
Any discussion, any questions? They're pretty good reports. There's a lot in those reports, so like I said, we used to kind of present them, but there's a lot of information for you in the reports. All those reports will be part of the minutes as well. So we'll attach them to the minutes because it's gonna go under one agenda item.
So does Laura have any minutes off in the next 90 days? Is it wheels down every day?
Yeah.
all day?
Laura, I think she's gonna take the board on overtime and she's.
I do have a lot of things planned.
Yeah. That's good.
Mhm.
But any questions, I mean, that would be good. Any questions of leadership, anything you want to highlight to the board, that would be a good place in the agenda to kind of do it as well.
Up until your internet actually gets.
I think by the end of June, we'll do the switch over. So.
Yeah, they're guaranteed speed test compared to the others.
Yeah, they're this, same amount of speed. It actually will help us because we have VoIP phone through the company. Went with the county when they switched over their phone system, so. But by switching to the new company that has the same VoIP phones, our traffic won't be going over the actual internet. It'll be staying within their network, so the quality of our phone calls should improve. So that is a benefit too.
So better phones, more bandwidth, and you're saving us money.
So
Some of you should learn to do.
Yeah.
You don't want me to learn.
I just mean the,
Because the internet will slow down, right?
Better stuff for less.
And the rate of immunization will go up, which is.
Yeah.
Craig, what's the, you mentioned last month, the friendliness of the website needing help.
Yep.
So what's going on?
Basically, we're moving away from the county's hosting of our website to kind of hosting our own website. The downside is there will be a hosting fee to host our own website. A lot of health departments host their website. You basically have to pay a monthly fee to some sort of company to host the website on their server. So the good thing is we did get a good deal on hosting services. And then we're also kind of using this time to redesign the website too. Because over the years, you guys remember when we first combined the county and the city, we redid our website. And at that time, we moved to the county hosting our website. And over the last, how many years? It's been 8 years. The county lost their, it was Aardvark Communications, was doing the website. They since went out of business. And I think the county's been searching for a new provider. And slowly as they've been updating the current platform, things have been breaking. So our kind of website, the layout and everything's gone kind of downhill. So it'll be nice to move to something where we can have more control over and manage instead of relying on the county too, because that's kind of been a challenge with our website currently. So.
We do have a tentative goal by early June to kind of have some kind of a skeleton for the new website. Is that correct? Right.
Yeah, we should, once we get the layout and everything down, a lot of it will be transferring the information from our current website and then adding stuff as we go. Yeah, hopefully by the end of May, June, we'll have a functional website on our new platform and we can continue improving as we go. So.
You mentioned fees. What kind of fees you talking about for a month?
Well, we paid upfront for 3 years. Like I explained in the minutes, it was like 50% off. So I think it was about $500 for 3 years of service. So that's, yeah, normally it was around like $1,200 for 3 years, but so yeah.
And they oversee what, the maintenance or?
Yeah, just basically all the posting of the information, any maintenance on the actual equipment used to host it. We'll still be in charge of keeping it updated and things like that. Basically, the back end part where you go to the website and everything's displayed, that's kind of what they manage.
So mechanically, how does the content get posted, or do you solicit from each department? Or
Yeah, we have a.
Are you in charge of that?
Yeah, we have a communications team, me and Cheryl, and we have one representative of every department in our health department on that team. So we're kind of charged with keeping the website updated and as we go. So that's why we have like someone from each section so they can look at each part of the website and make sure it's up to date for their particular section. So.
Okay. Thanks.
Lindsay, for our level 2 classes, are we gonna have any in this county? We're scheduled out months or something?
We have them planned every quarter. The next one's here in June. We just had class in March.
Yeah. I have a couple there.
3 more for this year.
Yeah.
Yeah,
Once-
first
Yeah, I
and
think
Anybody else? Questions, comments? We have a first and a second. You guys ready to vote on the twos? All right, all those in favor?
Aye.
Any opposed? Guess motion passes.
all right.
All right, so 3.0 board action. All right, we need to approve recognizing the following revenue for fiscal year ending 12/31, 3.11 Community Foundation Grant Award and Translation Services Pilot in the amount of $9,900. There's also 3.1.2, also Community Foundation 3-year Mobile Health Services Award in the amount of $25,000. Do we need to separate those or we vote together?
No, they can be voted together. This is, again, to approve, recognize the revenue from those two projects into this year's budget.
So in 3.12, is that 3 years times 25,000 each year? or-
No, I'm sorry, I might have confused a little bit the way I wrote that resolution. It's the Community Foundation Year 3 Mobile Health Services Award. So we did, right, so this is our
25,000.
third year into it.
And how many years was that?
Right, this is our last year on with the foundation.
We need to apply again.
Probably, that's what we started exploring, some options for. Ramping up a lot of the billing. We, again, that first 3 years was kind of to get it out, to get it started. And I think we have a good start. We're gonna start going back and show what we've done this 3 years, not only to the foundation, but to Rotary and everybody else that funded their projects, the city, the county. And see how we can move forward with them subsidizing some of the cost. Because a lot of the outreach we're doing, some of it is billable, some of it is not, and that's the nature of what we do, especially the mobile clinic. We're reaching out to people where they at, and then a lot of times, some of them don't have insurance, some of them don't, they're not connected. So I think as we are finishing year 3, we're trying to kind of close the circle here on all ends with the community health worker on board, people who needs to be connected to insurance. They got to be able to connect them to insurance, other services. Any way we can just again do wraparound type of service out of that mobile and solicit some grants. We are part of the Mobile Health Clinic Association, the national one, and you might see it on your bill schedule next month. We paid $299 a year. We did do a trial the first year last year, and it seems like staff really like the resources they have. They went to a conference last Friday down in Columbus for the Ohio chapter, and it seemed that they learned a lot about funding sources and where to get grants and stuff like that. So I had a brief talk with Laura here a little bit earlier in the week, and I think we're gonna start working on a plan on how we can fund that project moving forward.
So we need to reword that to say like 3rd year annual.
I think third year, Community Foundation,
Community Foundation, 3rd
year.
year annual mobile health services
Yep.
award.
Or final year also.
Yeah, I don't want to say finally.
Yeah.
I'm hoping that I'm.
The original.
Give up.
No final, please.
I just.
Show me the movie. It's, no,
Don't let me go.
no.
I meant the original.
Yeah.
Yeah.
So I think third year mobile health clinic award, that was award. Yes.
You know, in talking to Brian Treese at the awards, I really feel the foundation this really fits what they want to accomplish, and we just need to.
I mean, the whole community, the
Yeah.
feedback we've got even before having Laura on board. I mean, just taking it to
Yeah.
out in the community, people were kind of, anxious to see what this can do. Now, when we published our health equities report, that put more emphasis on it, and especially with the community health improvement plan.
Yeah.
Can be used in so many ways, and so many agencies feel like, there's a need for that outreach. In my report, actually, we were invited to present at the National Association of County and City Health Officials 360 conference. That's in July. All expenses paid, to just go talk about how that mobile project came about. And I think me and the mayor are gonna go down and see how the whole thing, started. So it's getting national attention. I think this is pretty good. And we want to do more of it.
And I really think you opened the eyes of like the trustees that were at the DAC meeting and wherever you've presented the assessment to show where the needs were in the community, because I think people have no clue.
That report. Phenomenal.
Yes.
I've been able to
Eye-opening.
utilize it for the art grant.
Yeah.
but It's just
Yeah, even your,
great.
Oh,
See the
everywhere.
what
Got it,
schools
yeah.
to really target and,
Yeah.
you don't want to leave the others behind, but you know,
Right.
to prioritize.
In every meeting, I get tons of questions about it. Actually, next week or the week after, I'm going to present to the Chamber of Commerce freshly brewed business. I did present it to the board, the Alliance Board, last couple weeks ago. It's amazing. Businesses are gonna use it, and to kind of make sure they have strategies for hiring and bringing people in, what the needs are. There might be business opportunities, the growth there. You know what? Maybe we have a food desert in one of those senses. Why don't you think about a business there?
sure.
There's I think it has a lot of value, and I think we're capitalizing on it pretty well. Laura's done a phenomenal job reaching out to the county as well.
Mhm.
We don't want anybody to feel like they're left out of what we're trying to do. For as much as we want to target the areas that need help, we're not gonna relinquish our duties everywhere else. So
Definitely.
I think this is.
And I don't recall, have you updated the Rotary in a,
Not yet. We are going
Presentation?
to. We are going to. We're taking the mobile actually to in next month. Is it the 4th?
I think it's 17th, I believe.
17th.
okay.
So we're scheduled to go and update Rotary on the progress on that too. I'll offer free screenings for Rotary members that day. I think it's good. Yeah, this is all laying the foundation of, going back and say, you know what, that's what you supported the last 3 years. We might need your help.
So how do you, when you go to a village, for example, how do you do that? Is that through their churches or
So-
central location or what?
So I'm kind of like looking at all different facets. So not only churches, well, I started looking into churches more recently, just because I know that that's a lot of times the heart of a community, especially in some of these smaller communities, like Benton Ridge, for instance, with like Karen over there. You drive through Benton Ridge. I've never driven through Benton Ridge until like.
I wish I hadn't.
Well,
So like, that's really like one of the only public areas in the area. So, when thinking about how to get this out there and who, and where we should go, that was one of my main thoughts is like, rural Ohio, let's do some church events as well. So not only are we hitting churches though, but like last October, we went over to Marion Township's house. Somebody reach out to some of these more of the trustees to get into their township house, because there's great utilization of space there that we can, start doing some more screenings and medical services out there. So, and then to publicize it, we get out newsletters into like with Karen, we're gonna put them into the sewer bills. So it goes out to all of, Benton Ridge, so they all know. I'm working with College First, to get, that's the church, like that's kind of surrounded by the University of Finley.
In that
And part
area.
of that, like Health Equities report, that's a huge
That's-
target area.
Definitely.
So working with that pastor, and he's going to, when we plan an event, get the information, the flyers out to all the community. So just go put them in the doors, and say that we're gonna be out here at this time. Really trying to get into those different demographics in different manners. Like we went over to the library has a speakeasy event, so it's English as a second language. And it couples kind of a lot with Alexa's Help Me Grow clients and families. But they had a very positive response to me coming out there. I couldn't see everybody. I'm like, I gotta come back next month. Like, I had a line.
Now, is that where the translation issue
So the
Yeah.
yes, correct. So that's the kind of, spill over to the translation issue. So, we now have translation services with those iPads. So, next month I'll be able to utilize those for like medical translation. When I went there in April, we had a translator come over, I believe he might have been from the university to help translate, but really utilizing medical translation is best practice. But there is so much need out there. Like they've not seen anybody in forever. Like my one example was a guy, he's like, I just have this ear pain. I'm like, okay, what's been going on? Well, it itched, so I, put a Q-tip in there. I think something stuck.
Probably in there.
So he, I think, had made a makeshift Q-tip and like took like cotton and shoved it on something. He had cotton stuck in his ear. Yeah. So like, just facilitating that and getting that taken care of because he wasn't gonna go anywhere, so just those things and
And it's
also.
such a snowball effect.
Oh, yeah.
Because, like, no insurance coverage, how do we get them in touch with insurance
Yep.
coverage or
Mhm.
services? So
Yep.
the really great thing about that program is they have in-person translation
Yeah,
for Spanish and for Creole.
Yes,
At
and
those events.
yep, exactly.
So each month they kind of highlight a new resource in the community for that clientele.
It's a great, it was really well received and, like.
Such a good turnout.
Oh, it was such a good turnout. I was like shocked. Like people are lining up. I'm like, okay, like I can't, the library lady, I wanted to keep seeing patients and she's like, you can't, we gotta. I'm like, I can't.
Well, I was thinking about that. I mean, where do services start and end?
Yeah, I don't.
How do you
We
get
need
away?
we need a second mobile, so you just prep yourself here.
I'll tell them.
Wow.
Practicing.
Domino's is up until 3 AM. So I have the facility.
Could you imagine what would come through in the nighttime hours?
That's a good point, Brian, because Public Health 3.0, it's out in the community.
Yeah.
They're not-
Yeah.
Well, we really need a dentist.
Oh,
I'm serious.
Did you hear that the dentist left the Family Resource Center? Yeah,
So that's why they're not taking
There
patients.
is no
Yep.
free clinic.
that used to be.
The dentist left.
Yep,
Yeah.
the dentist left. And
Mm.
I just found that out yesterday, because I just had some guy come in with a tooth abscess.
Mhm.
Yes, so many dental issues,
That's a big
especially with that
problem.
population.
Yes.
Because nobody accepts Medicaid. So you have all these patients who have poor
They're
health
getting
and
it
then
out.
also dentition, and we all know how dentition
Definitely.
and general health just.
Definitely.
coincide.
Children that need fluoride.
Yeah.
Dr. Kos is making.
Ouch.
Yeah.
Piggyback off of, the increase in the immigration, that it's not just in Finley. We had a disease intervention specialist at the regional call on Monday, and they were talking, that's more of like your HIV or syphilis, those type of things. And they said since September 2022, they've had 2 positive HIV cases of immigrants. So, if you've got that, you think of the umbrella of what's underneath that, and especially having that translation, because you can't have that and have their spouse that they cheated on come in with them. It's probably not gonna work out so well. But yeah, so it's, I don't, like,
It's
when I
gonna be
talked to our
challenging.
vaccine, we had our BFC site visit yesterday. I don't know, maybe he's just not in the trenches to know, but he didn't really mention Columbus, that when we talked about the increase we're seeing. But when they were on that regional call for it, everyone, was like, yes, we're seeing so much Creole and so I don't, a lot of different refugees, a lot of the different factories that are bringing them in.
It's just more and more every week. You get more referrals. I can't imagine where it's going.
But it's
to
just
kind of
everything that
plateau.
comes with it.
Mhm.
Yeah.
Oh,
Sure.
definitely.
Every time I volunteer, there's been translations.
Yeah.
And to just add to the mobile outreach value, we are participating in meetings for this, in preparation for the solar eclipse here in less than a year. I think Lindsay's keeping track. What's the countdown? How many days?
Oh, Kurt's
Same place.
actually the.
Kurt, 300.
62.
300.
You just put it up there on the white.
So we are thinking about, the traffic and kind of our population doubling or even tripling, from, what we've seen in other parts of the country who have that.
Luckily, we're on the full Umbra. It's Tiffin and Norwalk and
Yeah, well, it's,
Or like
Forest,
7 seconds
Forest is
less.
the epicenter. Forest is that's where all the action is. So, but there's not much in Forest, so a lot of the overflow is gonna be Findlay. So we're thinking of, uh, deploying the mobile to the southern edge of the county, to do triaging and stuff like that, so we can relieve the hospital from, little stuff that will happen that can be done out of the mobile too. So, it's all plans now. We'll come back with a more firm plans, but, that we're all working on that as well. And the mobile has, again, every planning meeting we go to, with the sheriffs or the police or the EMA, how about deploying the mobile? What's your plan deploying the mobile? So I think if people started to realize
It's around 6 PM too, so it gives people time to be after work and, if you.
well, it's happening on a,
It's on a Monday.
it's a Monday.
Monday.
So we have that weekend leading to, there's a lot of moving parts to that solar eclipse thing. We want to make sure grocery stores are stocked with enough water and stuff for the people who are coming. The Chamber of Commerce and the Lions start working with the hotels and motels. By June, we'll be able to see, kind of gauge a little bit how many, what's the occupation rate, or kind of reservations for that weekend.
Wow.
Schools, we talked to schools are gonna be off that Monday.
We're gonna have extra kits on hand,
Yeah.
recovery kits.
Well, I think, and you know what, the planner and us and, for in public health, we will hate to think that way, but we have to be prepped for anything. When you have so many people, it's April, what if it's tornado season? Gosh, sometimes when you start thinking about those, or snow, or we're all hoping for really cloudy day where you can't see. So, but about the business community, really banking and, the farmers, some of the farmers, they're banking on setting up campgrounds and stuff like that. They're banking on businesses. I mean, it's a good time to visit Findlay. It's just, I think we're tasked along with safety and everybody else to just keep it safe. The last thing we want is a foodborne illness from somebody selling food out of their yard there. And people are coming from all over the country. So it's, like I said, it's gonna be busy time for us, but, we don't like it any other way.
Do you think this would be like Woodstock? Or?
Exactly.
Yes.
Somebody brought that up. Absolutely. Yes. Somebody brought that up in the meeting.
Exactly is.
We went Woodstock too.
Now Woodstock.
You're not that old.
You're not old enough to.
That's our era.
Yeah, it might have been a Woodstock.
Yeah, I'm old enough.
I said, were you at Woodstock?
And,
Have a good.
our fire chief, police
I
chief,
would.
they're talking to their counterparts down in Blast in Kentucky and Tennessee. To see what to expect, and everybody's prepping for it. I mean, all the agencies. Probably we're gonna have to open our emergency operations center for that weekend as well. For the county one, for probably joint information center as well. Try to push information that way. So a lot of ideas, they're still cooking right now. Go from there.
And it's public health week.
And it's public health.
It is.
Yeah, it would be.
So more to come, probably, and moving forward, in each and every meeting, you're gonna hear about this solar eclipse here, bits and pieces. They're coming together.
Ryan, is there any other insights that since you've attended some?
The traffic was absolutely crazy. Because,
Because they all want to go home.
3 minutes, it gets quiet,
It's like
it
when
gets
you
light,
go Fort
they run
Lauderdale,
through the
I
cars.
feel like-
I love that.
Like
Canal-
you
The
couldn't get off
highway-
at an exit, you
Canal,
couldn't
not-
find a bathroom,
where's
you
the
couldn't get
Kennedy?
gas station ran out of gas, you name it, it was happening.
Traffic jam.
Yeah,
And
the highway
we were
for,
going
Yeah.
8 miles an hour on the highway going
Best thing
north,
you
so
can do
then
is
your
find
map
somebody
quest
to
was
stay
like,
close.
sending you whatever map software you use, it was taking you down a side road to go, so then half the people went there and those roads weren't moving.
I think,
Companies.
oh, yeah, that's a concern. I think,
Best thing is stay where you are for like 7 hours,
yeah,
or camp there, you know what I mean, or something.
actually to kind of,
No restaurants, you could get food, it was 2-3 hour wait to get food places.
I think the highway patrol is on the table with those planning sessions too. I think their main concern, they want to keep 75 moving here because a lot of people are gonna stop by side of the road and start, watching the eclipse. So I think that's their main concern. Sheriff and police are concerned with traffic in and out of, the different areas of the city and the county. It's,
Well, being on the northern edge of the lumber line, we're gonna get a ton of people from north coming.
from north as well, because Toledo, they said they're having only a few seconds of.
Yeah, they don't have to. I mean, there'll be a lot of people coming here to Forest.
So are you talking like Canada?
Well, I don't know. How far they come. I mean, we went
I don't
here
think
to Nashville.
Canada's not gonna experience any of that.
There are people
be.
that just come down and go to these things. There was one in Australia, 2 days ago? I knew
Yeah.
2 people that went to it, but, they planned a trip in Australia for 10 days because that was there. And while they're
A
there.
lot of people believe in weddings during the eclipse and everything else, so,
It's a wild time.
Wow.
yeah.
Oh, geez.
That that was
Special baby.
information too. I don't,
Who else would it?
all right, back on track.
All right, and we're voting on 3.0, 3.1, 3.1, 3.12.
We need the first.
3.2 has an alternate.
We need a motion, Cheryl, Shannon, we need a motion,
on
please.
3.1 and 3.12 with the reverbiage of 3.12. Saying
Third
third
year.
year annual.
Mhm.
Do we have a first?
So moved.
All right, second.
Second.
All right, all those in favor?
Aye.
And the motion. All right, 3.2, we have some appropriation increases and I'll let you tell us all about it.
Sure. Appropriation increase to the following for fiscal year ending at December 31st, 2023. 3.1.1, we want to increase appropriation in the general fund contract services line item, the amount of $5,000. 3.1.2, we want to increase the general fund appropriation in the equipment and software line item in the amount of $4,900. 3.1.3, we want to increase appropriation for the mobile health clinic project and the salaries line item in the amount of $25,000. And that's the money that we recognized earlier. We just have to appropriate to the appropriate line item so we can go ahead and start spending from it. In the public health emergency preparedness project, salaries line item in the amount of $30,000 as well. 3.1.5, the Get Vaccinated Ohio, we want to increase the salaries line item appropriation in the amount of $30,000. 3.1.6, that's in the COVID-19 vaccination projects. We want to increase appropriation to the equipment and software line item in the amount of $4,140 and no cents.
That one is the add-on.
That's what we added from the Monday agenda I sent out.
Questions?
Kareem, this is minor, but shouldn't those read 3.2.1, 3.2.2? Isn't this under 3.2?
Oh,
Mhm.
Oh, yes, you're right. Sorry.
Have you updated Word lately?
You know what? That agenda
Updates are important.
template I've been working with for so long, some of it is, it will kind of set it up. for you.
Probably the slow internet. It's gonna be fixed.
Well, I think we'll all agree it's Craig's fault, so.
second.
It's a tough crowd today.
Oh, he's seconding. We need a, first.
So moved. Second.
All those in favor of the 3.2 point.
Yeah.
Yes.
Yeah.
Yes.
Yeah,
Yes.
everyone?
Aye.
Bill, you in?
Yeah.
You're in. All right. No negatives. All right, everybody's a yes.
Okay, now we got into the more serious stuff and all those actions will need a roll call vote. So bear with me here a little bit. 3.3, this is, we need the Board of Health to approve a cash advance from the general fund 08 to the fund 8215, the amount of $75,000. We need that cash advance to start setting up the project for the NASTAD supplemental grant that we got and we told you about last month. But we need that cash advance from the general fund, so we can start setting up that project, and we start, expensing our time and everything else we wrote in that. Is that pretty accurate? Ken? Is that pretty accurate, that description of that item?
Yes, that's correct.
Okay.
Yep.
So, we need a cash advance approval. Again, in the amount of $75,000 going to the NASTAD grant project to set up the project and start expensing from it. We need a first, second, then we'll do a roll call.
So move.
Second.
All right. Roll call, you marking the boxes?
Yes. BJ, she said she's gonna be a little late, so Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill,
Yes.
Brian,
Yes.
and Dr. Linda Moon.
Yes.
All right, motion passed. 3.4, Board of Health to approve first reading of the proposed 2023 sexually transmitted infection, reproductive health, and wellness clinic fee. We did tell you in previous meetings that we are the sub-grantees to Allen County on their reproductive and wellness grant. We always wanted to do that since we started since the merger. This is becoming an opportunity for us to start on it. And we're gonna get 44,000 towards that. A lot of it is gonna be billed as well. That's what a lot of health departments are doing. So we're gonna do robust billing on that service. The clinic is we're working logistics still, but it's gonna be open twice a month, every other week, one day a week on Tuesday. So we're gonna start slow and see what the needs are. I think being a stop grantee now for the next couple of years, it's gonna give us a chance to kind of feel what the needs are, how this is gonna go before we go ahead and apply for a full grant on our own. We're in the middle of the cycle anyhow. We couldn't apply for one right now, and that's why we teamed up with Allen County to be part of their grant, and we'll do our deliverables, then we'll invoice Allen County, and Allen County will funnel the state money to our program. So at this point, and before we start, I think we are starting sometime mid-May. May 16, that's a tentative date. It's gonna be very soft start. We're gonna start with services to some of the clients that Alexa's and her team are serving right now that needed that. Some of the STI infections that we're getting through our infectious disease nurse and the nursing department. We're gonna start soft until we get the good feel out of it. Laura's going to a lot of trainings. She's going to a lot of meetings. Dr. Post is really collaborating on, connecting the dots before we go ahead and start. Good morning, BJ. So, the proposal for those fees are kind of copycat from what Allen County is charging. So it's not, fees that we came up with. Those are the customary fees for that particular projects that they're charging in Allen County. But to be able to bill and to be able to charge for people who are willing to pay for those, we would like the board to kind of do the first reading on those. And I can bring them up if you guys have any questions. We can. Again, we're not gonna have all those services in there. This is just a comprehensive list for if we do get into any of those, we'll be able to bill. And that's the whole idea here, recoup some of the expense.
And these fees are the same as Allen County?
That's correct. Dan, our billing guy, we did talk to him, and we're working with him closely on that list. He did check with insurance companies. He seems to think that this is kind of on the lower end, so insurance company are reimbursing more for those items. But at this point, I don't think we want to disrupt any of the sub-grantee agreement we have with Allen County. So we're gonna start with, at the low end here and kind of see what we can do in a year or so. We'll bring it back. If we are to increase them, we'll bring it back to the board as well.
Hey, can you get a preemptive, that customary and usual fee schedule?
Well, we do sliding fee for people who can't pay or they're paying themselves.
What I mean,
You mean,
like from insurance companies, they have that
They do,
customary and
they do.
usual fee schedule. Can you get that so we can compare for next year?
he did, well, he did compare them and he seems to think that those are a little lower. Is that correct, Cora?
Okay.
And so he got that from like commercial insurance. I primarily think that we're gonna be billing Medicaid.
Yeah.
And if I had to guess, I would say completely, mostly Medicaid.
Then they're all
because-
locked in at some other rate anyhow.
Exactly, yes.
Yeah.
And so why we followed suit with ODH too is Allen County is because ODH just sang Allen County's praises for how their department works and how they do their billing and everything. So I figured if it's not right.
They already have it figured out.
Yes, they've been doing it for multiple years, so I figured they know what they're doing.
So this is what Medicaid would pay?
I believe so.
Yeah.
I'm not 100%, but I think that that's what they do.
It's close to the Medicaid, but commercial insurance would pay a little high.
Typically, like when Dan does our billing fees for like vaccines and clinical stuff, which I imagine as we get more into this, what we'll do is he'll take our average payer, which right now is Anthem, of what they'll reimburse us for. And then we'll create our fees around that. So that's kind of what he did for some of these. And I think some of them, so if you don't bill for it, you're not gonna get that max. If you bill for it, you're still you might not get all that, but at least you'll be up to that. But one of the things that Laura and I talked about in this grant is that if you have your fee schedule, but we have someone who comes in who doesn't want to put it through insurance for whatever reason. And through this grant, we have to honor that. That comes out of the grant money. So instead of being paid. So this will give us a chance on this first year of the grant to see how many of those patients are we seeing? Because if we up those fees, we're still gonna have to charge that fee then to the grant. Does that make sense?
Yeah.
So do we think we'll probably get most Medicaid and that'll be okay to maybe raise it? But if we end up getting a whole bunch of anonymous people that won't bill, that's gonna come out of that grant money that we receive. So this will give us a good year to kind of see what we see here locally and go from there.
Give us more ability to see more patients too, so if we have more funding to spread across more patients, that's better than, more funding with less patients in my perspective.
Yeah.
Any other questions?
All right, do we have a first motion? Second. Leave the roll.
Roll call. BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill.
Yes.
Brian,
Yes.
and Dr. Linda.
Yes.
Salmon over there.
First reading approved. The next item got to do with that item as well. Board of Health, when we hear readings, we have to read them for 3 times. But given the timeline that we want to start next month, hopefully, we want to be able to, again, start billing for those services. So we would like the board to adopt those fees on an emergency measure. Then we'll keep reading as we usually do. And if needs to be tweaked in the next 2 readings, we'll do that. But I think for now, based on this reading, would like for the Board of Health to approve the adoption of those fees moving forward.
That makes sense to everybody.
Mhm.
So we have a menu of prices and then it may be permanent, which may change.
That's correct.
After the next 2 readings, okay. We need a first motion to approve the
So moved.
25.
Second.
All right. DJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill,
Yes.
Ryan,
Yes.
and Dr. Linda.
Yes.
All right. Next 2 items are kind of follow-up items from our discussions a few months ago as well. The first one is 3.6. We would like the Board of Health to authorize an agreement with the University of Findlay to provide clinical fieldwork education opportunities to eligible students in public health-related programs or studies. That's been in the work for a while. I want to thank Nancy for really helping on that. I think the challenge with the University of Findlay was always kind of having a coordinator and a go-to person to kind of coordinate those placements. And I think we achieved that in that agreement. So I'm hoping the board will just authorize to go ahead and move on it. It was attached to the thing, but I can bring it up as well.
So we had a couple questions when we
Sure.
brought this up before. Did you have whatever legal counsel you used?
I did run them by Cindy. It's taken a little longer. It, she didn't give me final answer by the time we had the meeting today. But I was looking so not to wait for another month that we can, pending approval of our legal counsel, we'll go ahead and enter into those agreements.
Okay, because one of these is dated to start at our last meeting,
Yeah.
so they will change the date.
We'll change the dates and, kind of do the basic formatting. I think those are, template kind of agreements. I think this is kind of, each school have their own kind of set of rules and
Can you bring
policies.
8 up there, term and termination?
8.
The renewal of this one is not the same as the renewal of the other one. It's 1-year increments with an auto renewal, but it doesn't give you a 90-day out if you think it's not working out, and 90 days before you notify that you don't renew. Your only way out is to give a 1-year notice, which that's not how the renewal is in the other contract with the other.
Sure. I don't know. You wanna address
Which
that?
is, which is unusual, to be honest. I mean, you're locked in for a year no matter what. I mean, you can get out with a mutual agreement. But
Yeah.
sometimes when you get out, it isn't mutual.
My feeling on those type of agreements and they're binding in a way where, what, if one of the parties want to get out or we have an issue with, the students or the university have an issue with, one of the placement they've done, I don't think it will be an issue as long as we're coordinating and talking to each other. I think this is kind of just a format to formalize that relationship and be able to kind of say, okay, you know what? We're not gonna, put that agreement on the desk and kind of consult with it every time we get a student here. It's just a matter of a framework of how this relationship is gonna be more than anything else. My feeling in the other ones, it's the 6 months because it's a semester thing. So if they place the students or if they planned on, placing students during that semester term, they will be able to kind of finish that term.
Yeah.
That's
Well,
my feeling.
theirs has a 90-day before the end of the year, you can notify you don't want to renew. But then at any time during the 1 year, you can give a 6-month notice that you want out at 6 months.
Right.
So that
So-
one has 2 ways out. This
So-
one doesn't really have one at all, other than a 12-month notice, which is
So-
unusual.
So you like the other, you guys like the other way around better, the one you described?
The other one just gives you more options, and because it's students that way, I get it, but I think this one should have at least that 90-day at the end, but am I reading either of those incorrectly, Bill? Because you read the.
I'm just, I guess I envisioned sitting down as a board with legal to explain what you're just saying. I mean, that's what I thought.
If Cindy's gonna look at this, we could probably wait for her to give her opinion. I assumed that she was going to look at it before we did anything more.
But what, with this February 23 date?
Yeah,
on there, I
that's
didn't
gonna
think
be
she
changed.
did
That's
that
fast,
one,
yeah.
so.
That can be changed. I mean,
Yeah.
that's not a big
The
problem.
dates and stuff will be changed to reflect. what-
Specifically ask her to look at that.
Yeah,
Right.
So you guys don't want to take any action until we get legals back? Is that what I'm gathering here?
I mean, earlier you worded it in a way that subject to legal approving.
Yeah,
Right?
I mean, that
And-
will,
and I'm not against that, but that term,
yeah,
the
absolutely.
other one is just so much different than this one. And this one has I think it's this one that has the HEBRA rights for the students, and the other one doesn't. So I don't know if that's a difference between the universities
It's,
or not.
yeah, whatever the universities, I think they,
I don't get both, but for the kids' files,
that's correct.
right? And
I'm
and I don't
kinda-
think that matters on either side, really. I just, it's the preference of who you're dealing with at the time, but it's kind of weird that when the year's over, it automatically renews for a year and you can't get out for a year. I mean, these are planning the divorce before the marriage sort of.
Well, I'm concerned about, well, I'm kind of jumping ahead here, but with, when we not dealing with the University of Findlay, I'm concerned about the optics of 7 and 8 with the University of Findlay. I think this sit down also provides an opportunity for different departments to weigh in on any of, or particularly the Green Agreement. I think we did a really good job with dedicated staff during the pandemic, and I just don't do that.
Oh, yeah, no, I think we understand that dynamic. I mean, after all, both the University of Findlay and BGSU wants those agreements with us more than we do at this point. To be honest with you, because every college now is positioning themselves to kind of for some of that funding that's gonna come, dealing with the shortage of, health workers and public health workers, dealing with a lot of that. So they, and I think they're on the right track and thinking, okay, they, as places of academia, they need to deal with that issue as well. And that's why they're reaching out and, forcefully saying, okay, you know what, we want a partnership. I think there's mutual benefit to us as well. I don't think we should discount that. Being a teaching health department, it's, one of the first in the state to be teaching health departments. I think this is a big deal. Having some of our staff go and actually, give lectures at BGSU. I think it's valuable as well, just to get the word out and tell people what we do and get the young people interested in what we do as well. I don't think we should delay those any longer, to be honest with you, as your hired professional. My feeling is we'll let legal sort it out. We'll fix the dates on those and we'll move forward with them.
So me, I'm not gonna sign any of these today. We're just gonna agree that we kind of like them. And then, I like.
It's up to
everything
you
they're
guys,
doing,
yeah.
Getting the kids in here and having them learn in this environment and, what I mean? That's kind of good all around. Hopefully.
Yeah, and this is all setting up for probably not the summer term, but it will be for the fall. I think that's why they want to know. Some of the students or programs we're working with, they want to make it part of their curriculum to come in here and put a few hours in the something like that. So from their planning purposes, they need to know. I think we shouldn't stall any longer. Yeah, go ahead.
So, would everyone feel comfortable, moving forward with, contingent upon final legal approval?
Mhm,
And then you would sign it after we have the final legal approval?
mhm.
I'm good with that, but
Does that occur?
Through Kareem?
right, our legal is Cindy.
Yeah.
Cindy.
Well, is she gonna be in the room?
Like with us, I mean, is that what you mean?
I'm
Yeah.
not sure.
We can invite her if you guys want. I don't know if. she
Well,
has time to come.
since we didn't draft the documents, I'm really concerned about who drafted them.
It's the respective universities. They draft the documents.
But she would do a thorough review. Would you
Yeah.
wanna, I'm trying to remember what committee, kind of helped with those kinds of things in the past. Would you want just, I think you were involved in that, Bill, but
We can
maybe
do
join
finance, look at them.
and meet with Cindy?
Yeah, and if you guys feel like we can wait another month, we can bring it next month as well. Hopefully we'll get final answer and I will invite Cindy to come as well.
To this meeting?
Yeah.
I'm just not sure that that's,
She would come.
Yeah.
I mean, she can
She's busy.
sure, but
Busy, yeah.
I'm just not sure we're gonna be at any different point that we will gain anything by waiting a month.
Right.
I agree.
Do we want to have a special meeting?
I guess I'm feeling pretty comfortable with it, so if Cindy signs off on it, I guess I'm not seeing a big risk or downside.
There's, yeah, liability is very minimal in those things. I mean, it's just like you said, Bill, you know, that the optics of it might not look as. Liability is very.
It might be because, you know, we do so many agreements at the hospital like this that it's just very familiar.
It's kind of,
I mean, it's familiar to me as well, but that renewal is weird.
Yeah, if something really happens terrible, you get out of it. What are they going to sue us? I'm serious. I mean,
There is a line that it can be.
No, but if something is really not working out well.
Yeah.
You just say, hey, this is not working out well, let's move on. I don't care what this agreement says,
I mean, we've done that. We had an agreement with the community college that was based up north and, it didn't work well and we ended up just terminating our agreement and we stopped their rotations. That's been a long time ago, but, that's the only one we've ever had.
It does give you a mutual out if you agree mutually in writing.
yes,
Both of them.
yes.
Good news is that there's always individual agreements when you have a student. So there's also an agreement that comes with each student and there's
Yeah.
always ways out if, for example, a student isn't performing well.
Mhm.
That's detailed in there very well.
Yes.
Yeah.
Yeah. I think those are a good start for agreements, and I know the lawyers in the room might not agree with me. I only play one on TV. No. But, but I think for the board, I think you need to look at the liability and the risk of liability, and it's very minimal in all the agreements we're presenting today. It's just formality, like DJ and Dr. Lindemuth said. Anytime we have an issue, I mean, just sitting down with that coordinator and sorting it out, even if we wanna, we don't know what might happen. I mean, here, and we might go into another emergency or something like that, heaven forbid, but things will happen and we need to get out. We'll get out. That's my feeling.
So, but the plan is that you're gonna take this. to Cindy.
Absolutely,
I mean,
yes.
It's been 2 months, she hasn't read it yet, I guess.
Well, those I got a couple weeks ago, so she's working on them, on her own schedule.
Okay.
So she's busy, but,
So we won't give the final okay till she does somehow, or
Yeah.
just approve them like. let's
well,
move
we
forward?
can approve it contingent on Cindy signing off on it.
All right, she had a word for you.
And then if any of the board members would want to join in.
Absolutely.
That
We
meeting.
can arrange for a meeting one-on-one with Cindy and to go over anything. But once she approves them, I will send them back out with all the corrections. Give you guys a couple days, I think, to look at them, and then we can call for a meeting with Cindy for whoever. It doesn't have to be a board meeting, as long as we don't have more than 3 board members. We won't have quorum, and it can be one-on-one meeting with Cindy.
So I would make a motion to approve this contingent upon legal approval through Cindy.
Second.
I would move to table that motion until she approves it.
Okay. Getting motions here.
This has never happened.
We never tested that, but that's good.
Bill, what are you worried about? I mean, seriously.
I'm a board member only,
Okay.
and
I mean, is
so
it something specific? Just-
I'm not acting as the attorney for this.
I don't feel, great harm in waiting till our next meeting too. This way, I think I want everybody, happy with whatever decision and vote we do today. And if there's some doubts or some, things we're thinking about here, I think we should bring it up. So I don't feel a great harm in kind of delaying that by a few weeks until we meet again. hopefully we'll have final answers and we'll be able to kind of move beyond that.
And if that's the path we go and wants to sit in for some questions.
Absolutely,
whatever.
yes. I will start today on kind of contacting Cindy and let her
I have
know
a
your
written
concerns.
question about the renewal clause.
Yeah, and I will tell her about that, and she will.
With an A, B, and a C, I think there should be a D.
Okay. And like I said, I'll email it to everybody. You guys will have a chance to read it, and then if you want to meet with Cindy at a time, so we don't have a board meeting, we can arrange for that. That work? Everybody's happy? Good.
You got a couple motions.
I will
We have a
withdraw my
couple motions
motion.
to the- Okay. So motion to approve contingent legal action is withdrawn, and we have a motion, Bill.
Well, I would move to table it until we have that meeting.
Okay. So we need that's a first. Well, that's the motion. I think we need first, second, and we'll roll call vote on that too.
I'm gonna say second.
All right.
I mean, I think we had opportunity for her to look at this and she hasn't. I don't know if she's busy.
Yeah. And
Your tax dollars.
These were drawn up by attorneys that get paid a lot of money to protect someone, and it isn't us. We need us person to look this over.
So will this prevent the, like the PA students from helping with the Dexcom?
I think
That's not till fall, right?
not only that,
Summer.
we do have some that we're doing currently. We're funneling all the students that are coming through the Medical Reserve Corps volunteers. So they're coming as volunteers. Once we credential them as volunteers, we are placing them in those different clinics as volunteers. And this is not to bypass this, but this legal binding agreement, official agreement as a public health with the academia in town and beyond. I think it's important for us to keep progressing on what we're trying to do here. Again, we're not, there's not shortage of students coming because we are all coming through the Medical Reserve Corps
So
volunteers.
they all have to sign up. as
That is correct.
reserve
Yes.
volunteers.
And to be honest with you, it's easier because that program keeps track of their time, keeps track of their schedule. But again, those formal agreements between the Board of Health and the universities in here and beyond, I think it's an important step. I mean, that's my feeling about it. Okay,
So, and that doesn't preclude us from, hypothetical, Cindy sees this next week and there's some timeline we need to hit quick, we could have a special meeting for 'em.
if we need to, but I'm in talks with both universities, I think, and waiving another month, I don't feel like it's a big deal. But
Okay.
if it is, I will let you guys know.
All right. All
Okay.
right, so roll call.
To table 3.6, we got a first and a second. BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill,
Yes.
Brian,
Yes.
and Dr. Linda Moon.
Yes.
All right, that will lead us into the next two items, 3.7 and 3.8. Those are agreements, both agreements, one for affiliation with the Health and Human Services at Bowling Green University, and another one is establishing Hancock Public Health as a teaching health department. So we'll go with the first one. The first agreement, again, foundational criteria to distinguish HPH as an academic health. So 3.7, you guys, do we have
I
a
would
motion?
think they would, 3.6 and 7.
They follow the same path
Yeah,
to the board. So if you want to
table
give
it,
a motion,
similar.
okay, I have a motion to table 3.7 as well. Second,
And that probably would include 3.8.
right. we're going to- You have a second for those,
To be clear, Cindy hasn't looked at that one either.
well, all three of them are signed.
All right, second.
Okay, BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill,
Yes.
Brian, and Dr. Linda Moon.
Yes.
3.8, this is for the affiliation agreement for practical education here through BG, SU. I assume, do we have a motion one way or another?
Table, same.
Need a second?
Second.
Okay. BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill.
Yes.
Brian,
Yes.
and Dr. Linda.
Yes.
Okay, I think it's March is the end of first quarter, and I think that's when we look at the financials here. And try to make sense of what's going on with our budget back in November. And on the first side, it will show you the revenue trends for the first quarter. We did go over this in details with leadership. And kind of look at the different items and what's behind on bringing revenue and what's not. And it seems like that first quarter is not gonna tell us much that early in the year. A lot of our programs are seasonal. We are moving into a new electronic billing system. And that's trying to catch up as well with previous years. But on the flip side, if you flip it, it will compare it to previous years. It's pretty comparable. The only thing is we did spend a little more than this kind of those thing months. Based on last year's, we did spend a little more than we brought in. But like I said, I won't get too excited that first quarter. It's just a number. I think a better picture of how our budget is performing would be mid-year probably, because a lot of our grants will start in July. A lot of seasonal stuff will be over with by then. It'll be a good time to look at it in September and see exactly how we're at. But for this purpose, again, nothing red flags to me. It looks like we're smooth sailing here in the first quarter. Again, we're a little behind on some of the revenues, but that should be made up and wait for mid-year to kind of have a better idea.
I do have one little request
Sure.
for next month. In the pie chart, is there any way to use some different colors? So my
Sure.
poor little eyes can't differentiate
Yeah, between,
different shades of blue.
okay. Did you, Lindsay, note that, please? Thank you. That's a
Specific colors.
Yeah.
Different colors.
different contrasting.
One of them has to be the.
Sounds
color of
like
your
a
blazer, 'cause
mobile
that
health
is awesome.
clinic issue.
That one we can see.
I vote yes on that.
I agree.
I have a
Contrasting.
question about the mortgage.
Sure.
I'm guessing it's a fixed rate. How long is that locked in?
That we're locked in for 15 years.
Fixed rate?
Yes.
Okay.
And I think what we're gonna actually, Mr. Beverly, the banker who helped us for that grant, that
Nice.
is starting contacting me again here. Let's make sure everything is going all right. This is our third or fourth year. Is that our third year? So we're gonna, as we get closer, we're gonna start exploring how moving beyond the 15 years, what we're gonna do, but
What
we still
bank
have
you guys use?
time. Is that Citizens National Bank?
And then, and these are, it's why I'm asking these questions in a minute, but what bank or banks or accounts with cash? I mean, I said we have 1.6 million on hand.
Oh, that's the
Is that in
auditor's
a few
office.
banks or
No, that's the auditor's office. And usually they use Fifth Third Bank.
the third bank? Because we have a lot of cash. I don't know how much we have.
We do, and that's, well,
I don't
thank
know if
you.
we're getting interest. on
Thank
any
you
of
for the
those
question.
accounts
No,
because
no.
it's pretty high right now.
No, we don't get interest.
I don't know if
It's-
there's an ability for you guys to, go out to.
Our fiscal administrator is the county auditor, so
Yeah.
we do not manage our cash on our own. We do manage our budget. The Board of Health has the ability to kind of say, we don't want an auditor to be our fiscal administrator, and we can go on our own. But I think we explored that back at the merger, when I first came on board. Seems like there's a lot of services that we get from payroll to HR stuff through the county. I think it will be in our best interest to stay with the county for that matter.
I'm not just.
And our cash fluctuates. Our cash fluctuates. I mean, and that's a good question because it shows that, you know what, we're not bringing as much revenue, but our cash is back to almost $2 million,
Yeah.
up about 500,000 from last month. This it fluctuates depending on that day, what came through the state for our expenses, the reports that we submitted, depending on what grants we got, depending on what's not been encumbered yet. So that cash does not reflect our budget position right now, and it fluctuates. Like I said, if we pay payroll, probably next week will be different. It will be different if we pay the bills. It depends on different things hitting at different times, but that's not a very accurate representation of where our budget is right now. Because if you look at the 2 million, well, that you guys made 500,000. No, that's not how. It depends on what we encumbered when. So that's why we like to keep that number and show it to you guys every month to just gauge. I think our average cash balance for this year, it's been hovering around $1.5 million.
Okay.
So pretty comparable to what we ended the year to. And again, mid-year, it will give us a better idea. Is there more money coming through grants? Is there more money coming through the different projects we're working on? Is billing, starting paying dividends? All that stuff will come more into play. But I don't want this number to be deceiving to you guys.
My point, if you always have $1 million and it's just sitting there doing nothing, and the checkbook never goes under $1 million, and you get no interest on the $1 million. There are accounts you can put it in that are liquid. That would give you 4.5% to 5%, and I mean, that's.
Yeah, well, I think the business,
green,
the business guy in you is showing, and that's a good point. It's a good point, but I think we're done for profit. I don't know how we will handle that.
Put it towards the mortgage payment.
Yeah, I don't know how, again, we have to look reasonably on how we can charge interest on our cash balance. All nonprofits and especially government, and we talked about that a lot, when we first merged. If you have cash or you want to cash, even when I went in front of the budget commission, when I first started, I did ask, how come we don't have a rainy fund? They said, you don't need a rainy fund. That's your cash carryover. Having a rainy day fund, that's not a good idea for government nonprofit to have.
Who would we be able to bring into as a resource into this group to let us know?
I think it would be a good idea to bring the auditor in.
It's like
Probably.
30 to 50 grand a year in the next 12 months. That would
I
be
think we're
easy.
gonna keep the county officials pretty busy between legal and auditor. But yeah, I think the auditor is our go-to.
Charity, right?
The finance.
Charity would.
Yeah.
Should talk to Charity.
And we can arrange for a meeting if you feel like.
And it wouldn't be income if you immediately put it towards debt reduction or something else.
Probably there's a way,
Do that.
more than I do on those, but yeah, it's always been that we can.
Bureaucracy is different.
I understand.
Yeah.
Definitely not the
Not
same.
necessarily for the good, but it's different.
Okay. Any other questions on the budget report here? Concerns? Very good. Well, Dr. Coase.
Just a couple of things. One from infectious disease, COVID, influenza, monkeypox, everything is pretty much settled down. I think we had one patient in the hospital on, unless you know anything different, BJ, on Monday with COVID. I think the biggest thing is going to be what happens with vaccinations. What's going to be the recommendations as time goes on, if they're going to be added with influenza, which is what people talk about, but we'll find out more on that. I don't think it's been released from Ohio.
No, and interesting enough, midweek, this week, like a couple days ago, Ohio Department of Health sent, an email to all, providers saying you do not give the monovalent, vaccine anymore. That put really attention to some of the, schedules we have that, people wanted the first monovalent vaccine. So they're moving into the bivalent now, and all those vaccines are.
Yeah, nobody's really sure what's the best thing.
Yeah.
I mean, it's trying to take the best, from what we can see. There's another variant, but the variant doesn't seem to be making any difference in what we've seen clinically, so.
So is there any policy that the health department wants to?
Not yet, Bill, as
Yeah.
far,
We usually follow the CDC guidance,
Yeah,
and the CDC, not the CDC, the FDA, committee that approved those vaccination, they met yesterday. They're gonna make recommendation to the CDC, and then CDC will come down to the states and say, you know what, that's how the guidance is gonna be. My feeling is they're gonna go with the bivalent vaccine for anybody starting the series. And eventually, they're hoping that by next fall, they will have kind of a combination of flu and a COVID vaccine together.
So if anybody's had a vaccine, what's the plan?
We don't know the recommendation right now. So there was a rep that stopped in, I won't say where from, yesterday. But you could tell he knew something, but he said there will be a lot to come in the next couple months.
Yeah.
So,
A lot of big pharma are working on it, so it's gonna be commercial.
after May 10th, May 11th is when
Midland.
Medicare will no longer, it will not be provided by the federal dollars, so we'll start charging, we'll have to purchase it. We have a lot of inventory that we'll be able to utilize first unless they quit using what we have.
Do you have a lot of inventory of the, what is it, the bivalent?
Of the monovalent, the primary series, no, we don't.
so it's in a state of flux. I do want to bring up one case, that we've had a case of TB, and I'll let both Shannon, because I think the board ought to know about this, not just from an infectious disease standpoint. It's become, it was a fairly advanced case. Dr. Radnasamy is taking care of the person, but it's become a financial problem about how this works. And Kareem, Shannon has been dealing with the problem. Kareem has been working with the financial, so I'll just turn it over. I think the board ought to know, because this
Sure.
could
No,
become
that's an excellent
contentious,
point.
and it also could become something that becomes more common as we see some of the things that we've talked about, finding things later, especially with foreign language and with all of those kind of things, that we haven't had to deal a lot with that. But
Yeah, logistically, we have the TB unit for the county. It's always been all the cases we deal with, it's been that, that the county commissioners will kind of put some of the bills, especially for treatment, because that's the law. This particular one, it's been ongoing for 8 weeks now. And we're anticipating hopefully one more week, but it might be more, depending on what comes out of it. This is really a long time. We had to isolate the individual because there was no way we can safely isolate them at home. So we put them in a motel, with no protected fence and stuff like that, that we looked at back, in our emergency preparedness stuff. And we are paying, and probably you'll start seeing the bills in the next schedule here. We're paying $500 a month, a week, sorry. We're paying $500 a week for that stay. We didn't have any other choice. Now I'm talking to Cindy and Phil Johnson from the prosecutor's office, because they are kind of fighting. The commissioners don't want to pay the bill, because they're saying this is not, he was in compliance. If he was non-compliant and you had to order him in there, probably the commissioners will pay, but because he was in compliance, they will not. They're not responding. That's their reading. We're getting guidance from the state on how we can approach that, but the bill, it's really adding up. Shannon and her team are kind of delivering the meals. They're getting the meals from 50 North. That's twice a day. 50 North they're gonna start charging us for that eventually. And the actual guy, I mean, mentally, it's a big toll on that guy for, to be in isolation for so many weeks. So it's been a difficult case we're working with. But to Dr. Kosa's point, I think this is something the board should expect moving forward, more and more of, especially if we're having a lot of immigrants coming to town to work or stay. We might have more cases that we have to deal with. It's an uptick all over the state. Even with the smaller counties like Williams and Henry County and all the counties, you see an uptick in TB cases as well. Shannon, do you want to add anything to this?
Yeah, so just to kind of give you guys an idea where we're at with the housing and the road that Kareem and I are kind of looking at going, I did reach out to some neighboring counties because I knew they had some cases as well and asked them, were they experiencing some kickbacks for that funding? Because the way the ORC reads is that if you're the TB control unit, that the county commissioners are the payer of last resort for treatment and the housing is included under the treatment if they are isolated. My understanding is that they are kind of keeping us back saying that they have to be non-compliant in order for them to pay, which looking back.
How do
to
you
the
comply
ORC,
with anything?
Well,
Well,
we wouldn't want them not to be compliant. for
What does
one.
that mean?
Exactly.
Meaning
well,
that-
Stan, I don't want to isolate.
Right.
And then we'll have to go to court. And then I think that's what they're looking for, is a court order, not our order. They're saying if a court ordered and few weeks back, I'm kind of struggling with this. I talked to Phil Johnson and Cindy and said, well, okay, you know what? This guy is kind of angry and he want out of that. So he might not be compliant. So maybe that would be a way to get a court order. Then they said, well, they talked to the judge and the judge said, I don't want to even hear him if he's in compliance. Once he got out of compliance, you can come to me. So we want him in compliance. That's the bottom line.
And which if you look at, if you really connect all the dots, it goes back to what the health commissioner has the ability to do and what they can order. So what we have done, and we've, Cheryl is graciously, I'm glad she has the ability and the past experience, because it states in there of payer of last resort. We've already reached out to the mission, we've reached out, to other places. There's nowhere to pay for free. We in addition went through this person's insurance company and are working on, we're waiting for the denial to come back. We've been in conversation, it's coming. They just have to do the formalities. So we will get that formal denial from the insurance company. Then the Kareem and I plan on. We have gone through all the steps as payer of last resort. This is part of the treatment. And then, we don't want to just give them the invoice. We want to work with them, but one of the recommendations was also to proceed and go ahead and invoice them regardless with the accompanying documentation of what the law is. But we would like to work with them because law, that's their duty as the county to provide the TB control unit. But I think we have learned through this case, they don't know much to say on here, is that it almost is a conflict of interest with our legal and the legal of the county commissioners. So,
For that particular case.
Yeah, I had a question, who's advising the county commissioners?
So, the prosecutor.
Yeah.
So.
So from a standpoint of the clinical part, I don't even know that I completely agree with the Ohio Department of Health. So, but that's beside the point. We are following their regulations, the rules of what we have to do to collect.
which follows the CDC as well.
Yeah, so where we are is we are doing clinically what needs to be done to isolate this person and their own medications, and we're collecting the specimens to make sure, and hopefully it will get resolved, but this could happen again. That's part of, just so everybody's aware of.
Conversation that like Kareem and I have talked about of like working with other housing facilities within the county to see like we've mentioned, like we feel like, knock on wood, but more than likely it's probably going to happen more frequently than we have in the past. In the past, I think I've had maybe 3 or 4 cases, maybe in the 8 years I've been here, Fortunately, we've never had a situation where I think we had one situation where we had to isolate the individual, and because of the case, we were able to use the University of Findlay at the time. But I think, like, even talking to other counties, because the population they're coming from, there's more likelihood, so I think that's
So there will be more to come to this, and like I said, we'll update the board, but I think I want to thank Dr. Coase for his guidance and bringing it up too as well. That's, I think that's a good point.
Yeah, the only other thing that I wanted to bring up is we are continuing to work on the CHIP plan. We've been meeting with all of the different responsible organizations. We'll bring some of those things back, as was brought up earlier. Really are trying to work with collaboration. We're having a meeting 9 o'clock today, Laura, with a couple of individuals from the healthcare system about referrals, things like that. And we've also been in contact with the different groups, Adamus Board. I think we're talking to the foundation next week. Bill, maybe I can talk to you offline. I talked to Kathy Fell. Now, I don't mean so much offline, but the relationship, Zach and I went and talked to her about what Bowling Green's proposed and some of the ideas that could be done at the university. So this is all a lot of interest across the community of having a community plan that everybody's on the same page and trying not to duplicate, to be efficient. So I think Kareem's been really involved in that. And I think it's coming together. So we'll get some reports back. Other than that, Mr. Chair, I have no more.
I have a question.
Yes.
What financial burden would this person that is isolated have? Like not being able to work?
That's one of them. It's creating a burden on his family as well. We're trying our best to get him some incentives and stuff from the state, but I mean, our budget is limited. We're begging for food to be delivered to that person. We're begging for, we're paying $500 a week. I'm getting calls from the credit card company saying, what are you doing Motel 6 every, for a week? So it's a lot. Staff time, we have to do the DOT, watch them how they're taking their medication, making sure they are. Dr. Adnan collaboration with him and Dr. Coase. I mean, it's mobilizing a big chunk of our staff. And like Shannon mentioned, it fortunately doesn't happen often, but for that particular case, the burden of disease was really high. It's been going for a while, and that's why it's taken longer. Usually responsive to treatment should be 2 to 3 weeks, but we're in week 8. Wow.
Is this resistant to the meds?
Well, there's special tests that needs. Yeah, there's special, it doesn't seem like it, but there's special tests that needs to be done.
And what's the exposure risk to our community?
Well, that's the reason we're doing. I mean,
Yeah, but I mean, are we?
No, I think.
This person
Now
from.
zero,
we
they're
check the
isolated,
contacts
yes.
and all of that.
He's under our care. Our nurses are with him.
Yeah.
But is this someone that's come into our community, or are we seeing it among the people in our community?
Somebody that's.
Okay,
I
is
was
that,
concerned about the Help Me Grow population.
Yep, we've discussed that, and done some internal planning, do we need to have annual TB tests on our staff and
Yeah.
what kind
kind
of
of the route
precautions?
we're going because we didn't use.
are we going back to what we used to do?
Right.
Probably so.
Yeah.
The reason I was asking is there's a neighborhood online place that you can post if you want, just all kinds of different information. And this family or the person posted that they were dealing with tuberculosis and having financial and emotional issues, and any help that anyone could give would be appreciated. And then came a post that said, we want to thank all of the people who have given money and help. I don't know what kind of help they're giving, but that was all online.
Oh, I wasn't aware of
I
that.
don't have it either. I mean, it's up
That-
to their discretion what they release. Thankfully, we haven't had an increase in.
Or nobody
Yeah.
called here and
Alarm,
hearing about it.
but-
Are you concerned about a scam?
I don't know.
There's more dynamics involved in this particular case that weren't, I mean, like I said, a lot of times we're able to make it work where they can isolate it.
At home.
But given the particular dynamics of this case, that wasn't an option.
Mhm.
And there were more
Yeah, the shared
financial burdens
compliance.
because of what needed to be done at home as well, so.
Hey, you'd worry about the family.
It was just, this wasn't a good situation all around, but I think as a public health, what we really need to look at is knowing the populations we're serving, the immigration status we're seeing come through. I mean, it was a headache in the beginning, like, are we at a stable spot right now? Has it been stressful? Absolutely, but the beginning was awful. And I think having like an annual plan or like, how do we plan financially even for this, especially if we don't figure the legal part out for the county commissioners
Yeah.
following.
How about we buy a house and make it?
Yeah.
So honestly, Kareem and I were talking
Yeah.
about like,
Gonna go back
what do you
to
do, buy a
Teresa,
camper? You're
Teresa.
gonna need this
Yeah.
every year? I mean, you figure how much
Enough parking
thousands of
lot.
dollars you've spent. That
I did.
hopefully we won't come to.
Yeah.
It's with the second mold in the soil.
Really?
Second one.
Yeah.
All right, Dr. Coulson.
I'm done.
Okay. I think a few remarks, I think I made enough remarks, just to highlight a couple things, and Dr. Coase mentioned that we are going in front of the foundation board next week. On a couple of occasions, I'm going with Dr. Coase and Adamus to present on the health improvement plan to see if there's room or opportunities for the foundation to be partners on some of those initiatives. That's the meeting on Tuesday. And I have another meeting with them on Wednesday just to present and kind of defend my proposals for the community health worker funding. That's looking pretty good. We're ready for those two meetings, and we should be able to see in May if we get granted that funds. Another thing, and I did include some of the bills that are being reviewed down in Columbus in my report. But one thing happened since I sent you the report on Monday. The budget bill, there was $20 million in that budget bill for public health. I think once the House got done with it, they removed that 20 million and sent it to the Senate. So we're back now, kind of lobbying the Senate to kind of put that 20 million back in there. But there's a big opposition to it. That's what we're hearing. But we're working with our association here closely to see what we can do. I was thinking, but it was late last night that I learned that they removed it. Maybe as a Board of Health, we can maybe do a letter and signed by all of you or the willing amongst you, and send it down to Cross and Macaulay. To just say, you know what, that 20 million is needed. You've seen what happened in COVID, something like that. So I'll see what the progress is, our lobbying. But if I need to, I might circulate something like that if you guys will be willing to sign off.
I'm in Columbus a lot, maybe I just need to.
Just show up there.
Go talk.
Take him some pizza.
Yeah, I mean, that investment is needed. If you look at it per capita, and I did the math a little bit as I was dreaming about the money that might be coming. And we'll be getting probably, because they want to probably divvy that up per capita. And with our population, probably we'll get about $150,000 of it. But nonetheless, it will be like, it'll be pennies.
Mobile health clinic be on board for a couple more years.
Yeah, something like that. So you should write a letter and talk to them.
Yeah.
So that's where we're at. Other than that, I think things are going well. We're progressing pretty well, transitioning out of the pandemic here. Busy. Everybody's been really busy. March been really busy. And this is good. That means we're moving forward. That's all I have, unless you guys have any questions.
I would like to recognize, I saw in the paper today, an obituary of Joanne Work. And she was on the public health the Fiddly City Public Health Board for years and was kind of a mentor to me and in kind of increasing my interest in public health. And so I just wanted to recognize her. She put a lot of years into
Was it Joanne?
Joanne work. She was the occupational health nurse at Whirlpool, and then she was on the city health board.
Oh, cool.
Were you on the board with her?
Yeah.
We lost a good nurse.
Okay,
Thank you.
Five.
any new business? No business personnel, like, we talked about last meeting, I did post that, community health worker position internally. And I have one staff that's interested in that position, and, I'm getting ready to award that, early next week. Cheryl, I think she had to leave, she has a meeting, but, Cheryl, with her experience and background, you know, in, kind of health navigation and stuff like that, she will make a good fit for that position. I did get permission from the state to transfer. She's currently paid under the workforce grant. So for between now and the end of June, she will be paid still out of that same. And hopefully by June, I'll hear from the foundation and other funding partners on who we want to move forward for that position. Once we get that position funded, we're gonna move to post that communication position again and hire communication person to help Craig and the communication team with the website and all the other stuff that we need to. So that's the plan here moving forward with personnel movement. Any questions? No continuing education today. Sorry, I'm gonna have to send you links and you study on your own. Our next meeting will be Friday, May 19th at 7:30, same place. If there's nothing else, we'll entertain a motion to adjourn, right?
Need a motion,
So moved.
second,
Second.
and the yes votes will be skid marks and parts.
We're out at 9:07.